So this video, we're going to go over some common nursing home medications. So when you go to your clinical sites and you're on the med pass, you can kind of know what are some of the drugs that these patients are taking. So let's start with the category of blood pressure and edema. So your blood pressure, you're going to see lisinopril, Atenol, amlodipine, digoxin. And for edema, we have hydrochlorothiazide, furosemide or Lasix, and the triaterine, which that is one of the potassium-sparing diuretics. Then let's see, for high cholesterol, you have Crestor, simvastatin, Lipitor, and lovastatin. Your blood thinners, you have Plavix, warfarin, which is Coumadin, Lovenox injections, and heparin. For reflux and ulcers, we have omeprazole, which is Prilosec, Nexium, Prevacid, allopurinol, which is used for gout, threw that one in there, and Protonix. Mood, so lots of medications that treat anxiety or depression. So you have alprazolam, which is Xanax, Sertraline, which is Zoloft, Ambien, that's going to help with insomnia. You have Aricept, that is for your dementia patients. You have Remeron, you have fluoxetine, which is Prozac, lorazepam, which is Ativan. You have clonazepam, Celexa, gabapentin, which is also going to treat epilepsy. You have Effexor XR, Paxil, Trazodone, and Seroquel. For pain, we have hydrocodone, which is your Norco. You have oxycodone, tramadol, Vicodin, and morphine. Your anti-infectives, these are your antibiotics. You have amoxicillin, azithromycin, cephalexin, which is Keflex, and ciprofloxacin, which is Cipro. For your COPD, your allergies, your asthma, you have Montelukast, which is Singlair, prednisone, Advair, and Allegra. And then some miscellaneous, most commonly used, nitroglycerin. We know that treats angina, which is chest pain. You have metformin, which your diabetic patients are going to be on. You have baclofen, which treat muscle spasm. Levothyroxine, which treats a low thyroid. And you have Celebrex, which treats rheumatoid arthritis. So again, these are just a few of the most common drugs used in the nursing home. As you can see, a lot are used for mood and anxiety, depression. You have blood pressure meds. Some of the most common that we see, especially the nitroglycerin, your Lovenox injections, those are going to be given to prevent the DVTs. You have your omeprazole, that's going to help fight that GERD. You have your antibiotics, amoxicillin. Pain, we're looking at morphine and hydrocodone. And for your high cholesterol, again, simvastatins. All of the drugs that end in statin are going to be your cholesterol drugs. And your blood pressure, we have the prils, those are your ACE inhibitors. Your OLOLs are your beta blockers. The ones that end in pine are your calcium channel blockers. And then we know that for edema and hypertension, we're going to use those diuretics. You have your thiazides, you have your loop diuretics, and your potassium-sparing diuretics. So again, just an overview of some common nursing home medications.